Hello, medical technologist community. Today we will discuss about rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder in which immune system identifies the synovial membrane as foreign and benign attacking it. Synovial membrane shown in picture. Definition: Rheumatoid arthritis is a chronic inflammatory disorder that may affect many tissues and organs, but mainly attack the joint, producing an inflammatory synovitis. You can see it in the picture: bone, muscles, tendon, inflammatories. Risk factor: idiopathic, positive family history, inherited tissue type, major histocompatibility complex, major smoking, bacterial and fungal infections, herpes simplex virus, Epstein-Barr virus, vitamin D deficiency. Incidence are affect 0.5 to 1% people in USA. Females 3:1, but people of age can be affected. About 10% women are women. These diseases strike women 3 times more often than. Pathophysiology: presentation of antigen of T cells, T and B cells, proliferations, angiogenesis in synovial lineage, neutrophils, accumulation in synovial fluid, synovitis, early penis formation. Content: subchondral bone erosion, penis invasion of cartilage, chondrocytes or proliferations, laxity of ligament, joint instability. Signs and symptoms. Symptoms and signs of rheumatoid arthritis. The joints of the hand are often the very first joint affected by rheumatoid arthritis. Thickness, perfect hand, SWAN neck deformation. The deformity arises from hyper extension of proximal interpharyngeal membranes. Mallet finger is a simple flexion free forming the distal. Severe hyperextension of interpharyngeal thumb. Content: fatigue, joint pain, joint tenderness, swelling, joint redness, and joint warmth. Joint stiffness, loss of joint range of motion, main joints affected, limping, joints deforming. Both sides of body affect, and what we will diagnosis of it. X-rays, magnetic resonance imaging, MRI, and ultrasound. Blood test: rheumatoid factor, RF, and anti-circulated protein antibody. Erythrocyte sedimentation rate, C-reactive protein, full blood count, renal function test, liver enzymes that shows the RF effect to the body. Medical management: salicylate, acetylated, aspirin, nanosylated, choline, magnesium. Non-steroidal anti-inflammatory drug included. Gold containing compound, anti-inhibit T and B cells activity, suppress synovial during active stage of rheumatoid. Action: immune suppression effect, DNA synthesis. Corticosteroids action: anti-inflammatory, analgesic use for shortened duration of loading. Topical analgesics. Surgical management. Surgery is considered for people who have severe rheumatoid arthritis, including these things: cervical spine fusions to treat neck pain and nerve problem, and finger, foot, and synovectomy to remove inflammatory tissue. Nursing management. Nursing diagnoses acute and chronic pain related to inflammation and increased disease activity. Self-care deficiency related to contractions. Impaired physical mobility related to decreased range of motion, muscle weakness, pain of movement, limited endurance. Disturbed body image. perceived life cycle or role changes.